This is Steve Brockmeier from Charlottesville, Virginia. And today we're going to go through a CuffMend augmentation for rotator cuff repair surgery. So let's go ahead and start on the back table. So these are the tools you're going to need for this procedure. Let's go through the key elements. So first, right here, we have our graft spreader. Here is SpeedFLEX. This is a pre-sutured graft of a particular size, and you can pick your size based on your procedure. Here we have the FiberStitch RC Simple. So this is the updated version of the FiberStitch RC, and it comes in both a straight and a reverse curved orientation. You have your portal skid here that we use for insertion of our implants. Here you have your tensioner cutter. The mega loader is available for this procedure as well. It's very useful for loading sutures into various implants. And then finally, we have the 3.5 millimeter peak-tipped self-punching push locks, which is useful for lateral fixation of our graft. One thing I want to highlight is that as the graft is put in the packaging, there are actually these cleats that allows the sutures to remain untangled. So here's our graft. The sutures are all preloaded into the cleats themselves. All right, so now we have our graft. You can see here laid out on the back table. This pre-sutured SpeedFLEX comes in basically 4 configurations. So you have the 20 by 25 and the 25 by 30, and each comes available in either a 1 millimeter or a 2 millimeter thickness, depending on your choice as far as the amount of tissue you want to use for augmentation. On the medial side, you have preloaded 0 fiber wire sutures. And then on the lateral side of the graft, you have preloaded tiger links for either shuttling of suture or for fixation laterally into the push lock anchors. So first we'll load up our medial sutures. So graft through. One of the novel features of the mega loaders is it's got a large aperture, so you can pull your entire hand through it, pull the sutures, get it loaded up. Speeds up this process quite nicely. We'll pull through the second set here. So as we fix this, you can see we're bringing the sutures above and crisscross to tension the graft medially. So you have good security of your graft. And then we're going to bring our secondaries, and we bring this into the lateral cleats here. And for these, I typically bring them directly to have that graft under good tension for when you insert it into the space above the rotator cuff for your augmentation procedure. All right, so now we're back in the shoulder. You can see that we've executed a 3 medial row, 2 lateral row, FiberTech speed bridge, cuff repair. You can see this tear basically involved the upper infra and all of the supraspinatus. This is a pretty common tear configuration for me where I'm considering an augmentation procedure. From a positioning standpoint, this is beach chair position. This procedure obviously can be done through a beach chair or a lateral approach, just dependent on surgeon preference. The portal that we put here, our direct lateral portal, that's going to be our workhorse portal for placement of our graft. We typically like to cheat that a little bit lower so that when we insert our graft, it sits directly on top of our repair and gives us space above to work and fix the graft. We'll have a secondary portal you can see right here, and that we're going to use for medial fixation. Oftentimes, this is the portal that I use for my medial anchor placement, so it's kind of a more of a versatile portal, but you position that with this in mind if you're going to do an augmentation procedure. You can see I also have a direct anterior portal, and we're going to use that now to pull out the sutures. So I'm going to keep these preloaded knotless sutures here, and we're going to have those as an option for graft fixation laterally, but we'll pull those out of the way and bring them to the front. And then we're going to do the same thing with the sutures in the back through a direct posterior portal. So we'll come in from the back here and now retrieve these out of the way. So now we have all of our sutures managed correctly, and we got this wide open space for graft placement here. So you can see we're looking right at the repair, and this is going to be where we're going to orient our graft. So now we're going to move forward with graft delivery. All right, so one thing I want to note here is we're in panoscope mode, which is a huge benefit for a procedure like this. You can see this wide field of view where you can really get a view of basically the entire repair and where we're going to position our graft. So we got our preloaded graft that we've already set up on the back table right here. All right, so we're going to deliver it through. As I said, a lower positioned cannula is really helpful here for graft delivery. And you can see we got good working space here, and the graft kind of delivers down, and we can kind of put it in the position where we want it. All right, so the graft flips into place, and now we can kind of position it to cover up our repair and augment the area that we're focused on. You can see here on this particular tear, there's limited tendon, and this is actually pretty clinically relevant. We see this pretty commonly where there's going to be some lateral tendon loss. And so a lot of times I'll position the graft medial to your medial sutures from your repair, and so it truly does augment and kind of reinforce your repair. So now we have our prior portal. So, I'll typically do this in the OR where we'll kind of make sure that we like the angle of approach for our medial fiber stitches. So we're going to come in here with just a switching stick or some device to kind of get our angle of attack here. So you can see we're coming right down. And so, as I said, there's basically, the FiberStitch Simple comes in both straight and reverse curved options. Actually, with this angle, straight actually would work pretty well. All right, so our skid's in place. And here you can see this is a straight FiberStitch Simple. All right, so a novel version of the FiberStitch. We'll slide this in and you'll kind of see what I mean when I say that. So pull the skid out for us. All right, so this is designed to place a simple stitch. Basically, one pledget deployed inferiorly, and then the second will go on the superior surface to compress the graft. I'll sometimes refer to this in my OR as a sandwich type stitch, where basically you have a pledget below and a pledget above. So deploy the first one and just pull straight back and out. And then by pulling on this suture, you'll see it'll pull the second pledget into place right here. All right. All right, now, once we have it in position, we're going to load it up on our tensioner cutter. And you can see as we tension it down, and now you can see we have fixation there. You can see the pledget on top, and then the other one is below. And you got good secure fixation anteriorly. Next, we'll move to the back. We're going to put in our posterior fixation. And so this angle, I think a straight would work, but a curve might work better. So we're going to use a reverse curved FiberStitch Simple. You can see the reverse curved trajectory of this particular implant. I use these more commonly, quite honestly. It gives you a really nice angle of approach. We're going to pull the skid out, and you can kind of see how that reverse curve allows you to kind of come down and really be very perpendicular to the tissue. And that's one of the key things. You want to go deep. You want to go through this kind of muscle tendon junction tissue. You obviously want to avoid any trauma to the tissue below. All right, so you pull straight out, and you can see here that the second pledget deploys into the subacromial space, and then you can start to shorten your implant. Nice and easy here. And you can see this one's deploying perfectly where the implant will curl into this wagon wheel looking appearance, which is really nice. And then we're going to take our tensioner cutter. All right, now we'll take a quick look and make sure we're happy with our fixation medially, which we are. And you can see you can tug on this and this thing holds really, really well. We'll unload our spreader, remove our spreader, and here we are. All right, so our posterior sutures right here, anterior sutures right here, firm fixation with great compression of the tissue down exactly where you want it to go. So now we're going to move to our fixation on the lateral side. And so first, kind of a technical point, for suture management, again, you have these different portals you can use. So I'm going to work on fixation posteriorly first here. All right, so I'm going to come in and we're going to grasp the anterior sutures here, and we're just going to retrieve those out the front. And you can see my assistant is holding the posterior one so that the graft kind of stays centered. All right, now from a length standpoint, you can see where this graft wants to go. You want to make sure you're going to be able to tension to the lateral row, and it's going to pull it down. I think that'll pull it down really nicely. All right, so posteriorly, I'm going to use our preloaded knotless suture from our lateral swivel locks, and we're going to go ahead and link this to it and use that as our fixation. So you can see outside the joint here, what I'm going to do is I'm going to shuttle our repair stitch through the graft using the preloaded link. All right, let's go ahead and shuttle that through. We're going to watch and make sure that that goes the way we want it to. So we're shuttling this through and kind of watching it to make sure that it doesn't loop on itself. Looks great. And then we're going to load this into our anchor with our preloaded stitch here. All right, so tension this down provisionally. And then we'll go ahead and we'll keep the suture in. Again, sometimes we want to kind of fine tune our graft. So a lot of times I will leave this in place and not cut it off. We'll pull this out the back. All right, so now looking anteriorly here, as I pointed out earlier, you can see that this anchor is placed a little bit higher up on the tuberosity. So if we use that as our point of fixation, the graft's going to be a little bit redundant. I'm not going to love that tension and that kind of coaptation of the graft. So for this one, we're going to actually fix it independently using a 3.5 push lock anchor. So these are, again, the self-punching, peak-tipped push locks. So we're going to pull this out of our lateral cannula here. So first we're going to luggage tag that down. So you can see we're going to link it to itself and pull it down. All right, excellent. Here's our self-punching push lock anchor. All right, Perfect. All right, and then we're going to look at our position. So let's actually rotate the arm a little bit. All right, so we're going to put this right about here. I think that's going to give us good position for our graft. All right, and then we're going to tap that into place. And here you can adjust tension if you need to. Looks great. All right. All right, so we're done here. You can fine tune your tension if you want. You can see you can kind of dial this down a little bit more. With the push lock, we're kind of fixed in place. And we're going to cut our excess suture out from our lateral portal. So we can get rid of that one. And then we'll get rid of this one. All right. All right, so here we go. So let's take a look at our final construct. You can see our FiberStitch Simple implants compressing the graft nicely. Here you can see this one right there, and kind of with some investing tissue around it. Looks perfect. And then laterally, we're nice and tensioned with two different options, one anteriorly with a push lock, and then one more posteriorly using the preloaded sutures from the prior swivel lock for our repair. So I'm really happy with this. We're going to take it through a quick range of motion. You can see how this thing kind of cruises around in the subacromial space. So that really nice construct here.